Hello everyone, welcome to the session on how to create a visual abstract. I am Dr. Maitri Shankar, Associate Professor in Nephrology from Institute of Nephrology, Bengaluru, India. So here is today's agenda. We'll have a course session of approximately 30 to 40 minutes, wherein I'll be introducing visual abstracts to you all. We'll be discussing about what is visual abstract, why is it needed, why is it important, the skeletal framework of the visual abstract, and the design and tips of how to create a visual abstract per se. Followed by that, we'll have a short discussion and Q&A session for 10 to 15 minutes. And then we'll have a break. So we'll divide you all into three groups. We are three mentors. For the first 15 minutes, the mentors will demonstrate practically how to create a visual abstract. And then the following 1 hour will be given to you. You already have the journal article that has been shared with you all. So you can go through the journal article and create your visual abstract all by yourself with the help of your mentor's guidance. So let's start off with what is a visual abstract. It is basically a visual summary of the written abstract that is published. It communicates the key findings or the highlights of the article. It's something like a trailer for a movie. Visual abstract is something like a teaser for the article or the original research. So basically you see the trailer and then decide whether you want to watch the full movie or not. So visual abstract is something like that. You can go through the visual abstract and then decide whether the article is of interest for you or not. Mind you, visual abstracts are not a substitute for reading the entire article. You should not base your changes in healthcare policies or your clinical decision changes just based on visual abstract. You have to go through the entire article if you're planning to make any significant changes in your clinical decisions. So why use visual abstracts? They can be used in slide presentations. As you all know, a picture speaks 1,000 words. So visual abstracts increases visibility of the manuscript and it helps in widespread dissemination. It is very easy to share your visual abstracts on social media platforms like Facebook, Instagram, Twitter, LinkedIn, WhatsApp, and so on. So it helps in dissemination of the research article. So because of this widespread dissemination, few people might develop interest in reading the article completely, and that might influence healthcare policies, bring in changes in clinical decisions, and eventually improving patient care. So these days there have been many journals which have social media accounts, especially Twitter or the X account, and they keep posting visual abstracts on Twitter or X as and when new research articles are published. Coming to the history of visual abstract, it was first published by the Annals of Surgery in the year 2016 by Professor Dr. Andrew M. Ibrahim. He was the Assistant Professor of Surgery, Architecture, and Urban Planning in the University of Michigan. He was the one who pioneered and popularized VAs, and so he's aptly called as the father of visual abstracts. So this was the first visual abstract published, and these were the components of the initial visual abstract. Of course, the visual abstract has evolved now. So this was the initial one where you can see that, just a moment, I'll switch on the laser pointer. So yeah, you can see that there is a question here or the title which summarizes the key question that is being addressed, that is impact of treating iron deficiency anemia before major abdominal surgery, and they just have the summary of outcomes here. So it has decreased the need for blood transfusion from 31% to 12%, shorter hospital length of stay from 9 days to 7 days, and recovery of hemoglobin post-discharge has increased from 0.9 to plus 1.9 over a period of 4 weeks. And you can see that here is the citation, the journal where the article is published, and this is basically the visual display of outcomes. So in the year 2016, the first visual abstract was published, and by 2017, approximately 15 journals had begun utilizing visual abstracts in their social media dissemination strategy. However, the evidence for success of visual abstract was not much, and there was no hard data to support the impact of dissemination of research or the scientific information. So most of these visual abstracts were shared on Twitter or X. So now how do we measure the impact of these visual abstracts? So this is something called as Almetric score or alternate metric score, with the help of which we can identify the impact of the visual abstract. So the parameters of the Almetric score are impressions. Impressions is nothing but the number of times the tweet appears to users in their timeline or search results, which is a measure of exposure. Then we have retweets. It is the number of times a tweet is shared. It measures interest. Link clicks, that is the number of times the link is clicked. So this measures the article or the link visits. And engagement, that is the total number of times people interacted with the tweet. So that could include expansion of the tweet, likes, retweets, and follows as well. So this is how we measure the impact of visual abstract. So in order to assess if visual abstracts really increase the article dissemination, a prospective case control crossover study was conducted by Ibrahim et al. So they took 44 original research articles, 22 of them were tweeted as title along with visual abstract, and another 22 were tweeted as title only. So there was a 4-week washout period, and then there was a crossover. So the articles that were tweeted as title only were tweeted as title with visual abstract, and those that were tweeted as title and visual abstract were tweeted as title only. And finally the outcomes were assessed in the form of Almetrics, that is impressions, retweets, and article visits. So here is the result. Visual abstracts increase the impressions by 7.7-fold, retweets by 8.4-fold, and article visits by 2.7-fold. So this clearly showed that visual abstracts did increase article dissemination. There was another study by Oscar et al. Which reinforced these following results. So what they did was they took 40 articles and they randomized it and they tweeted. It was a triple crossover trial of visual abstracts to again examine their impact on research dissemination. So some of them were tweeted as citations only, some as citations with figures, and some as citations along with visual abstracts. So as you can see, the ones that are tweeted as citations with visual abstract had higher number of views, 2 times more views, higher engagement, 5 times more engagement as well. Now, what about manuscript visibility? So this again, another study was conducted, a cross-sectional analysis of all the original research articles published in the Journal of Urology the year 2017. And they found that the articles with visual abstracts were not associated with higher Web of Science citation or Google Scholar citation. But those articles that were promoted on social media with the visual abstracts had higher mean almetric scores. And these articles with higher mean almetric scores, they were more likely to be cited on Web of Science and Google Scholar. So just creating visual abstract for the article will not improve the manuscript visibility. You have to spread it across the social media platforms. So if you now see from past to present day, the visual abstract was first introduced in the year 2016, but by 2017, 15 journals had adopted visual abstract in their social media dissemination strategy. And from there on, there was limited evidence. So there were some studies which looked at evidence, and the outcomes showed that visual abstracts did increase research dissemination, and they also increased the citation of the manuscripts. So today we are in the rapid adoption stage. More than 100 journals have been adopting graphical abstracts or visual abstracts. The last I counted, it was around 113, and so it is continuing as well. It is continuing to grow as well. So this is where we stand today with respect to visual abstract. So visual abstracts were introduced in the year 2016. By 2017, 15 journals had already incorporated visual abstracts. Now, where do we stand today? Today, more than 100 journals have adopted visual abstract. I'm a nephrologist. In nephrology in particular, there are many reputed journals which have visual abstracts. There was a primer in visual abstract creation published by the Clinical Journal of American Society of Nephrology. If you're interested, you can go through. There was another article in the Seminars in Nephrology published regarding the importance of visual abstract, how to create visual abstract, and so on. And in the International Society of Nephrology, we have the social media curriculum, which I'm also a part of. So we have created a curriculum where we teach the registered users how to create visual abstracts, how to create infographics, in fact, how to use social media in the form of podcasts and video abstracts as well, and also how to create quizzes and stuff. So if you can take the entire curriculum and you will get CME credit points for it as well if you're interested. Now, where do we stand on quality? What is the quality of the visual abstract that is being published? So as I said, 2016 it was first visual abstract was published, 2017 15 journals. Today, as of now, more than 100 journals. So clearly we are in the rapid adoption stage. Many journals are adopting visual abstracts. But the pitfall is that anyone can make visual abstracts. You don't need a certified course, or you don't need a degree to create visual abstract. Anyone can create visual abstract. So because of which it is actually a pro, but there are some limitations as well. There is little oversight on the content design and quality because of that. Authors are often asked by the journals to make visual abstracts. They provide the guidelines as well as the templates, but there is limited editorial process. Like when you submit a manuscript for review, it undergoes intense review, but your visual abstracts may not undergo that much of intense review. However, some journals do have robust editorial process for the visual abstracts, like some of the nephrology journals like the CJAS and KI reports, Kidney 360, Kidney Medicine. They have a isolated editorial board dedicated only for visual abstract. So that is the visual abstract editorial board, and they have members in that board who create visual abstracts, and that is peer reviewed. The accuracy for content and design is checked and then published. So it is a must that most of the journals should adopt this process. They should have some kind of standardization for the quality of visual abstracts that is published, or that is that goes online on social media. So this was another study looking at the accuracy and design of visual abstracts in the academic surgical journals. So here what they did was they used a visual abstract assessment tool, and 7 reviewers were trained to use this visual abstract assessment tool. This study was conducted in the year 2022 by Godolin et al. And these 7 reviewers looked at 25 surgical journals from 2017 to 2021. They looked at 1,325 visual abstracts. And their idea was to look at the deficits in accuracy. So what was the result? There was a deficit in study design by 35.8%, inappropriate icon use in 49%, wrong sample size reporting in 69%, lack of alignment in 54%, and asymmetry in 36%. So the conclusion was that visual abstracts vary widely in quality. As visual abstracts become integrated as components of scientific publication, they must be held to similarly high standards. And the authors proposed that the journals should standardize the quality of visual abstract. So now we know where we stand today with respect to visual abstract. What we are lacking in is standardization and quality improvement. So in the future, this is what we're going to work on: standardization of visual abstracts and improvement in the quality of visual abstracts, which is definitely true, and I agree with it as well. So what can we do as individuals? We can take up tutorials on how to create visual abstracts. We can apply for editorial internships. There are many editorial boards which are calling in fellows for editorial fellows to learn the process of to learn the editorial process, and also to learn how to create visual abstracts side by side. When you create a visual abstract, it is a must that you send your visual abstract for feedback from your colleagues or your students or even your mentors for fact checking. And what can the institutions and organizations do? They can offer primer courses, like the wonderful thing that is being done by St. John's Medical College, workshops on visual abstract design and development. What can the journals do? They need to have robust editorial process for the visual abstracts. They need to have a separate editorial board for the visual abstract itself to institute quality and accuracy. So now we are done with the first part of the presentation about the visual abstract, the introduction to visual abstract, why do we need it, and the data or evidence supporting the use of visual abstract, and where do we stand today as far as visual abstracts are concerned. Now let's move on to the designing of visual abstract, the tips and tricks. Now let's look at the skeletal framework of a visual abstract, or skeletal framework, or the elements of a modern visual abstract. Basically, the journals to which you are submitting the article, they will usually give you a template. So you have to create visual abstract on the basis of that particular template. So this is the template from KI Reports, for which I am one of the members of the editorial board. So the template is basically the black canvas. It is the basis for making the visual abstract. The font is also specified in the template. You can see that the style of the font is already put in there. So you will be using only that font as per the requirements of the journal. And the color palette is already prefixed by the journal. So you have to be restricting yourself to just those color palettes. And you can see that there are various sections. There is a title section and there is a code body section, and you have the journal name here, and you have the citations of the author and also the credentials of the visual abstract creator, and finally here you have the conclusion. So the first portion is the title of the article at the very beginning. So how do you put in the title of the article? It is easier if you can just cut and paste the exact title of the article, of the written article, into your visual abstract, as you can see here. Or you could also use a question mark in the title to increase the curiosity of the audience. So if you look at this visual abstract, the title is in the form of a question, and also the subsections, if you see, even those are in the form of questions. So if it is a form of question, then it increases the curiosity and it attracts the attention of the audience. So here the title is what are the steps to prescribe SGLT2 inhibitors, and in the subsections you can see whom to prescribe, whom not to prescribe, how to prescribe, educate patients about what to anticipate, and how to follow up. Next, we have the methodology section. So in the methods section, you should have minimum information, that is about the population which is being studied, the number of patients being studied, the period of time of study, and the methodology, whether it is a cross-sectional study or randomized controlled study or a retrospective study or a prospective cohort study. So you can see here in the methodology section, we have put in some information that the study was conducted in Japan. It was a multi-center randomized controlled trial which was open label. 67 patients on hemodialysis were studied and the duration of treatment was 26 weeks. Now coming to the intervention in the methodology section. Usually in randomized control trials, we have intervention arm and the control group. So if you look at the intervention arm, it is usually depicted first. The intervention arm goes on the upper side by convention, and the control arm is lower down. So by convention, in all visual abstracts, the intervention goes up and the standard of care or the control group is lower down. So this is one of the templates that is provided by the KI reports. So you can see here that the template per se has intervention over the top and control over the bottom. Now coming to the outcomes, it is a must for you to showcase the primary outcomes, and secondary outcomes, whichever is relevant to the study, you can add into it. So the primary outcomes are a must. And finally, we have the conclusion. It is best that you put in conclusion as mentioned in the abstract in the author's own words. Do not interpret the conclusion, do not put in your personal interpretation of the paper as the conclusion. And then we have the reference and the credentials. We have the citation, the author of the article here, first author et al, and the name of the journal. So this is a must: first author et al, the name of the journal and the year of publication. And finally, give yourself some credit. So the creator of Visual Abstracts credentials goes there. So here are the various templates that are provided already by the journal. So you will have a various wide range of templates to choose from. So you can choose whichever template suits your study the most. So here are some of the visual abstracts that I have created. Now coming to some tips and tricks. Keep the visual abstract simple. Use the same terminology as used by the authors. It's okay if you're having blank space. If you're having more blank space, it adds more aesthetic to the design. As you can see here, there's a lot of white space in this visual abstract, yet it looks nice and pleasing. Include statistics if it is provided, if you have the numbers or the percentage, the confidence interval, the p-value. So adding those values to your visual abstract is very important. Always define uncommon acronyms. The common acronyms are fine, but if you're putting in any short forms or uncommon acronyms, it is a must for you to expand them. Avoid temptation of adding key figures because these are difficult to read on a small scale and also difficult to interpret without any context. I will be talking more about this in the following slide. And as I already mentioned, avoid inserting personal interpretation in the conclusion. So here is one visual abstract where I've just put in the key figures from the article. So please do not do like this. This does not make any sense and it is very hard for the person or the people who are reading it to understand the article. Now coming to the icons can be downloaded directly from websites like Flaticon, Noun Project and Icon Finder. So these websites usually require subscription to download large number of icons, but if you're downloading just 3 or 4 icons, I think it should be fine. And whenever you're inserting the icon, you have to make sure that you don't compress it too much or stretch it or expand it too much. You have to reduce the size or increase the size proportionally. So for that, you have to use the shift button whenever you are adjusting the size of the icon. So we will be demonstrating this. So when you go to these websites, you will find various types of icons. So here are some of the types of icons. We have solid or the monochromatic icons, we have the outline icons, we have flat icons, and we have filled outline icons. So whenever you're choosing icon, you can choose whichever icon of your choice, but make sure that all the icons are of one particular type. So if you're using solid or monochromatic icons, make sure that the entire visual abstract is filled with only solid and monochromatic icons. So it is very important to maintain the uniformity of icons. So keep the visual abstract very simple. Do not overload it with too many colors and do not use too much of information. Just put in the key highlights of the article. And sometimes you also see these 3D formats in visual abstracts. It is better to avoid 3D format because it is very hard for the eye to read the 3D format. Use 2D format. It is much easier and easier on the eyes to read the visual abstract. The more simpler it is, the more effective the visual abstract becomes. Like for example, here I'm sharing you 2 visual abstracts. So you can tell me which one is better. If you see the first one, there are multiple colors and you can also see that there is some 3D effect and it is not looking all that great. If you look at the other abstract, it is much easier for us to read because it is of 2D format and also I've used only 2 colors, pink and blue. Just that the shades of pink are varied. So minimal number of colors and 2D format is much easier and nicer on the eyes. And here you can see again 2 visual abstracts. In the first visual abstract, you can see that the visual abstract is overloaded with icons. I've deleted the center icon and the visual abstract looks much clearer with lesser number of icons now. Alignment is very important whenever you're creating visual abstracts. So there is this grid lines and guides on Microsoft PowerPoint and also scales that are available, which you can use to align your icons and the text. You have to make sure that the text and the icons are aligned both horizontally as well as vertically. So it is best to left align the text to maintain uniformity. So here you can see that there is one infographic, what are the causes of anemia and chronic kidney disease, and to align the text I have used guidelines and grid lines and guides. So for this you have to go to Microsoft PowerPoint view and tick on grid lines and guides. So you can see that there are small squares here which will help you to align the icons and the text as well, both horizontally as well as vertically. So there are various websites which will give you color scheme. You can go to Canva, Coolers or Color Hunt and they will give you a wide range of color palette. You can choose whichever suits you the best, and always make sure that you maintain contrast. If you're using dark text, you have to make sure that the background is light. If you're using light text, make sure that the background is dark. Like for example, you can see in these two infographics, the first infographic, the background is dark but the text is light here. So it becomes easier for you to read, and similarly here the background is light so the text is dark. If it is light background and light text, it becomes very hard for the eyes to read and it won't be very clear, the text won't be very clear. So this is just an example. This is how the Coolers website looks like. So you have various palettes, color palettes to choose from. Ideally 3 to 5 color palette should be good enough. Do not use too many colors also in your infographic or visual abstract. So coming to the font, always use easy to read font like Helvetica, Neue, Open Sans, Aptos, Roberto, something like this, something similar to this you can use. Do not use a font like Algerian, Bankway Script or Blackadder. It becomes very difficult to read and it is not very clear. And make sure that the minimum font size is 14 so your visual abstract is nice and neatly visible. And this font size also helps us in maintaining hierarchy. So like for example, if you see here, the title has greater font size and then the subsections have, so the font size of the title is approximately 24 here, and if you look at the subsection it is 20 and the font size of the text below is 16. So the font size also helps in maintaining the hierarchy of the content in your visual. So now once you're ready with the visual abstract, convert the visual abstract into a high quality PNG or JPEG format picture and use that picture to share it with your peer group or your mentors or your audience for feedback, and make sure that you incorporate the feedback that you receive from your mentors or your peer group. There are some limitations as well when you're using visual abstract for dissemination in social media. Make sure that the content is peer reviewed. If it is not peer reviewed, there is always a problem of dissemination of inaccurate information. And if you're creating visual abstracts for a case report, make sure that you have obtained patient's consent and the confidentiality of the patient is maintained. Do not use any commercially biased info, like for example, do not use the brand names of the drugs. Always use the generic names. Maintain professionalism. Always make sure that once tweeted it is in the public domain forever, no matter once you tweet it and then you go back and you delete it, no matter what you do, somebody might have already downloaded it and they might have already spread it like wildfire. So make sure that you think twice before you tweet your visual abstract or any content for that matter on social media, because once it's out there forever. So here is the brief summary of the visual abstracts. The first row gives us the pros and the bottom row gives us the cons of visual abstracts. Visual abstract is basically like a preview for the article. The reader first previews the article and then decides whether to pursue the article or not. It simplifies complex methods and summarizes the key outcomes. So we have already seen that it improves journal readership and also improves the citations. And also it helps in widespread dissemination of the research when you're using visual abstracts in social media. So applying principles of design depends on the user experience, the clarity and creativity, all that depends on the user. It is basically subjective. So sometimes we can oversimplify the paper and we can oversimplify the results. That could lead to misinterpretation and inaccurate results or inaccurate depiction of the results in the visual abstract. Quality control and standardization guidelines are warranted for creation of visual abstracts. And mind you, visual abstracts are not a substitute for reading the entire article. So you cannot base your clinical decisions or healthcare policies just based on visual abstracts. You have to read the entire article. So here is a summary or the checklist for creating an infographic or visual abstract. First, narrow down the content by defining the purpose, the key message, and the audience to whom you're creating the visual abstract. Second, draft a layout on paper that fits your purpose. So put in the title, put in what you want in the method section, put in what you want in the result section, and the conclusion. Third, select a software platform and convert it to a digital copy. So whatever you've put it on paper, use a platform of your choice. I usually use Microsoft PowerPoint. Someone who's using Mac might be using Keynote. So use the platform of your choice and convert it into a digital copy. Use a color palette of your choice between 3 to 5 colors and use it purposefully. Replace the text with graphics. You can download icons, you can use tables, charts. So replace the text in your digital copy with graphics. Obtain feedback from mentors, peer group, or target on audience and improvise on the feedback. So here are some sources for your additional reading. You could use the primer on how to create visual abstracts by Ibrahim A. Sijasan has a primer on how to create visual abstracts. There are websites like mindthegraph.com, biorender.com, canva.com, which already has templates for creating visual abstracts, and they also have icons. Social media curriculum by the International Society of Nephrology, and some articles are also available online for you to read more about how to create visual abstracts. Okay, so now it is activity time. So we will divide you into 3 groups and we will give you a practical demonstration of how to create visual abstract, and following that you can create visual abstract all by yourself. All the best, try and learn. See ya.